Joining us now, Jonathan Swan, national political reporter at Axios. His interview with the president aired last night on Axios on HBO. And Dr. Rob Davidson, an emergency medicine physician in Western Michigan. He's also the executive director of the Committee to Protect Medicare. Gentlemen, thank you for joining us. Jonathan, congratulations on an interview that Americans can look at, like Chris Wallace's interview, where you held the president's feet to the fire in this interview. There was so much to get to. It was a long interview, and there was a lot of stuff in there. What's your chief takeaway from your conversation with the president?
My chief takeaway is that he is not confronting reality when it comes to the virus, and he is reaching for data points that are good for publicity or sound good, but are not actually the best metrics for revealing what's going on in this country. And I think the big one is testing. You know, he talks about this number of the US has done more tests than anyone in the world. That's true, but it's also not a particularly meaningful thing to say, because the reason the US has had to do all these tests is because the virus spread undetected like wildfire through this country in February, March, April, and it took a very long time to get the testing working and effective. And we're still, as you said, not there with these delays. So people are walking around for, in some cases, 10, 11 days, spreading the virus, and contact tracing's out of control. So yes, that's happening. And he said to me, don't I deserve credit for all these tests? And I said, you would if hospitalization rates and deaths were going down, but they're going back up again. And where the US distinguishes itself is when you look at other countries that have wrestled this virus, you know, to some extent into submission, and they're heading down the curve. Not many of them are heading back up the curve, and that's what's happened in the US that's really, really concerning. And instead of grappling with that and trying to learn the lessons of what went wrong or acknowledge failure, he is searching for the data points that cast him in the most positive light.
Dr. Davidson, the struggle that I have, and I have it every single day with Donald Trump because he gives this response about testing, but in the interview with Jonathan, I was really struggling with the idea that the president does seem to be either unable or unwilling to distinguish between the fact that we do lots of testing, people are dying. They're not dying because we're doing more testing. The president seems to have this litany that says we have a lot of cases because we have a lot of testing. But to Jonathan's point, is he missing this point, or is he deliberately being misleading?
Well, it's hard to tell. He sort of had a deer in the headlights look about him during the interview with Jonathan when Jonathan was explaining to him what the testing actually meant and the fact that deaths were going up. I think his complete lack of empathy is evident when he says it is what it is. I've been doing my job for 20 years. If I went in a room and I saw a very sick patient and didn't think they were going to make it and told them and their family, well, it is what it is, what will we do? No, of course not. You do everything you can. You leave everything on the field. And this president just has not done that for the American people.
Jonathan, there were a couple of instances, more than a couple, there were a few instances in the interview in which Donald Trump said something. You intervened immediately with either not understanding what he was trying to say or getting clarification on them. In one of the cases, it was actually about testing. Let's just listen to your interchange.
Those that say, you can test too much. You do know that.
Who says that?
Oh, just read the manuals, read the books.
Manuals?
Read the
What
books.
manuals?
Read the books.
What books?
What testing does?
I'm sorry.
Wait a minute. Let me explain. What testing does? It shows cases. It shows where there may be cases.
Did you ever get an answer as to what manuals or what books you're supposed to read about this? Obviously, there weren't manuals when we started about this. There have been people who have written about it since. But do you know what he was talking about?
No, and there's no credible public health expert who is suggesting that there is a danger to testing too much. None that I've heard anyway. And if such a manual or a book exists that is credible, I'm not aware of it. But it's a very serious point because, again, public health experts say that until we get to a vaccine, the only way to get this virus under control is, apart from good social behavior is a very aggressive and rapid testing, isolation, contact tracing, quarantining. And the fact that he's, with this interview was conducted the final week of July, still expressing ambivalence over the value of testing is stunning.
And Dr. Davidson, the problem is, and Jonathan brought this up in his interview with the president, the problem is there are lots of people, maybe 35% of the country, who believe the president. There's a larger proportion who get their news from other networks which parrot the president. So in the words of Dr. Joseph Varon, the chief medical officer of United Memorial Medical Center in Houston, he says, we're fighting two wars, a war against COVID and a war against stupidity.
That's exactly right. And Jonathan brought it up perfectly, that people hang on his every word. And him telling people masks weren't important is critical, because I still have people coming in hospital. Just last week, a man came in and refused to wear a mask because the president told him this was fake. He said he didn't believe it was real. And so this is, we're fighting on multiple fronts. The president's making it more difficult.
Jonathan, there were a few other exchanges. I guess I'm trying to get to the bottom of how much of this is political expediency for the president and how much of it is a block where the president is either not getting the information properly or just choosing to ignore it. Because it did seem that there were moments in which you were presenting evidence to the president. At one point, he gave you papers. You studied the papers. You found that they were presenting contradictory information to what the president was suggesting that they were proof of. What's your sense of this? Is the president deliberately avoiding good science and good information, or do you suspect he's not getting it?
No, I suspect he is getting it, but he's impervious to it because it doesn't suit salesmanship. And, I started the interview actually by asking about a philosophy that he's been a proponent of for many years. He calls it the power of positive thinking. It's Norman Vincent Peale popularized it. It was sort of seen as a philosophy of self-help that had religious association. But Donald Trump applied this throughout his life. This is the idea that if you believe something, you visualize it, that it becomes real. It's perfectly harmless and maybe even helpful in commercial real estate when you're promoting a property or a reality TV show. It's even served him well in his political career. But it's unsuitable manifestly to the worst pandemic in a century that refuses to be swayed by rhetoric or spin.
Dr. Davidson, yesterday the president took a piece out of Dr. Deborah Birx, who I've been quite critical about on this show because she has gone out of her way to be misleading, particularly on right-wing channels. But when she finally went on to CNN and spoke the truth about something yesterday, the president called her pathetic. He's been doing this to Fauci as Fauci goes out and tells us the truth. So the bottom line is the people who do have the science around the president, if they go out and message in a way that doesn't suit him, he starts to write them off and cut them off.
Yeah, that's exactly right. And we need science to be leading on this. And the president is absolutely undercutting his scientific advisors, even the ones who tend to agree with him more often than not. And the public needs that. The healthcare community needs that. The only way we're going to drive this thing into the ground is by listening to those voices and not the voices of politicians who are, 13 weeks away from re-election. So that's the path we need to take. And it's unfortunate we have a leader who's unwilling to do it.
Thank you to both of you.